everybody, I'm Logan Crawford, and this is the award-winning TV talk show right here on Ebru, Fresh Outlook. Measles is back. It's an extremely contagious respiratory virus spread by coughing and sneezing. Doctors say it infects the glands in the throat, and from there it can spread even further, in some cases, into the lungs. And if measles gets a foothold in the lungs, it becomes life-threatening. Cases are creeping up across the United States, and many blame the threat and the spread on the anti-vaccine movement. Take a look.
Measles is a highly contagious respiratory disease which spreads through the air through coughing and sneezing. The disease brings a body-wide rash, high fever, cough, and conjunctivitis. Complications can include pneumonia and swelling of the brain, which can lead to deafness or mental retardation. According to the CDC, in the decade leading up to the 1963 measles vaccine, the United States had an average of 549,000 measles cases and 495 deaths reported annually. In 2000, the disease was declared eradicated from the United States. That has now ended. A strain of resistance from parents choosing to not vaccinate their children has opened a gateway for the disease to return, and today it is spreading.
Unless it comes down to religious reasons, I can't find any good reason why, not even that those are good reasons, but any good reasons why you wouldn't be vaccinating your kids if you're going to be a member of society.
On Monday, the subject of vaccines became political as Republicans leaped into the debate. Senator Rand Paul of Kentucky and New Jersey Governor Chris Christie made comments against vaccines, citing civil liberties, and that sparked debate over the liberties of the population at large.
It is irresponsible for people to not get their children vaccinated, not only because it puts their children at risk of getting the measles, it also puts at risk other children in their community, if it's infants who are too young to get the vaccine, or children who have compromised immune systems that they can't get the vaccine.
We're back live on set here at Fresh Outlook. I am joined by the Ebru think tank, Dr. Bart Rossi, who is a psychologist, Patricia Fauquet, who is a teacher of nursing at Adelphi University in their School of Nursing and Public Health. And also I'm joined by Tom LaVecchia, who is an expert working in the healthcare marketing industry. Patricia, I'm going to start with you. Okay. How big a threat is measles right now?
Measles is starting to come back and get a threshold in certain communities of children who are not immunized. Also those who were too young to be immunized and immunocompromised, like the video clip said. But also we have to look at those adults who only received one measles, mumps, rubella vaccine in 1985 and may not have gotten back to get their second one.
So after 1985, the protocol changed? Is that what it is?
Right. What happened before that was that we had several large outbreaks, especially at large colleges and universities, where the children had received their first MMR, but we didn't know then that they were going to have a second one. So a lot of adults had already left college and really probably haven't thought that they need their second MMR unless they've had the disease, which is lifetime immunity.
Now, take an old timer like me, born in 1962. I got my shots probably around 1963. Is my shot still good?
If you had your MMR and you weren't sure you had a second one, you could easily have a blood test for titers that could tell you if you have immunity or not. If you were born before 1957, then we all wound up with the measles as an illness, so we have lifetime immunity. So the easiest thing if you're an adult and you're not sure and you don't have your vaccination records is to ask your healthcare provider for a measles, mumps, rubella titer, and it would be able to give you your immunity levels for all three diseases.
Let's turn to Dr. Rossi now. Doctor, a lot of the anti-vaccine movement is based on fear and misinformation. What's your take on that, and what's the role that fear plays in all of this, and even selfishness?
Well, I also think it's fear and ideology, where people go down this road of personal freedom and less government, if you will. And really, they want to believe that. But yet, for the good of everyone, sometimes you need to vaccinate everybody. And the good of the nation is at stake here. And some of these folks want to go down this road of personal freedom and the Constitution, if you will, and it really makes no sense. They're putting ideology and fear, which is, I think it's really more ideology personally, than anything else, and it doesn't make good sense. It's not clear thinking. I don't like the way these folks are presenting themselves.
Now, a lot of the people who are anti-vaccine are fearful as well that
Right.
their child might become sick, and they are from another ailment such as autism. The other side of that coin is they're afraid of seizures, and they're depending on other people to get the vaccine.
Well, psychologists talk about low probability events, extremely low probability events as you're speaking about now. So the overall good of the vaccine will far outweigh any remote possibility of that possibly happening. And as we're talking here, it's probably unlikely that the vaccine even causes that type of a situation. It's very doubtful. So we're really talking about fear that is not warranted and ideology that is trumping common sense.
Right, and like I said, it's sort of like the herd mentality. If you feel the whole herd has been vaccinated, maybe your kid doesn't even have to be put at that minute risk because everybody else has it.
Right.
Yeah.
Right. Yeah.
Okay. Let's turn to Tom LaVecchia. You've been pushing for people to get vaccinated as well. Talk to me about the importance of that.
Well, it's critical because now you're seeing they're taking the foot off the pedal a little bit here in the U.S., right, in terms of some people being a little bit more relaxed, and you see cases pop up right away. So although it's the gold standard from a medical standpoint to get the MMR, people aren't doing it for religious or various other reasons. It's a little tricky to say if everyone has to do it in terms of maybe going against a religion. However, from a medical standpoint, it's accepted it has to be done. And the companies are established in safety and efficacy for these vaccines. So it's a gold standard from both a government standpoint as well from a medical practice standpoint as well.
Patricia, talk to me about the MMR vaccine again. Measles, mumps, and rubella.
Rubella is what people would commonly call German measles, which can actually cause birth defects in moms who may not be immunized and they're unborn.
So particularly dangerous for pregnant women to be exposed to German measles or rubella. Talk to me about the shot itself. When I was getting my children their vaccines 20 years ago or so, I was afraid of the mercury in the vaccine. You say that's no longer a component?
Mercury or thimerosal, which is a derivative of mercury, has never been in any of the combination measles, mumps, rubella vaccines, or even in the individual measles vaccine, mumps vaccine, or rubella vaccine. Thimerosal used to be used as a bacteriostatic, which meant that nothing would grow in a multi-dose vial. And now most of our medications are given in single-dose vials, which is why, but the public needs to know that there's never been thimerosal or mercury in the measles, mumps, rubella vaccine.
Let me tell you what I did stupidly when I was a young dad. I decided not to get my children the chickenpox vaccine because it was brand new.
Oh,
and
boy.
I didn't want any component of the herpes virus injected into my children. I said, we had it growing up, they can have it growing up, they'll be fine. My son got it. 2 weeks later, my daughter got it. 2 weeks later, my other son got it. For 6 weeks, we were dealing with severely sick children who had sores all over their body, and I regret it till this day.
And don't forget, because you've had the chickenpox, you are susceptible to the shingles.
Exactly. Yeah. So there is that fear that people have, particularly when a vaccine is new. Now I would recommend to parents get the chickenpox vaccine. It's been used successfully.
Right. But I think this is a really good example that you're talking about yourself here of overthinking. I mean, we can overthink situations. We can exaggerate the fear, and it's not warranted. And then what happens is we have a bad result. And I think we have to put things in context. And this measles issue here, I think, brings forward this whole concept of when are we going to be reasonable and thoughtful enough to make the right decision here?
Well, there's this anecdotal part of it that people latch onto. It's fueled by the internet nowadays, where you have one horror story of one person getting sick out of the millions and millions who are vaccinated, and you are scared to death because of that.
It just doesn't make good sense, though. It's like, I don't want to go outside because I'm going to be hit by lightning, but, well, then don't live. I mean, it doesn't make good sense.
But fear is like that. Fear kind of overwhelms your good common sense.
That's true, but sometimes you have to deal with it and make the right decision based on the facts and all of the issues involved, and some people aren't. And ideology, again, and for politicians, remember, it's appealing to their base, who are the most extreme. and then you get extreme results.
Tom, what about the religious objectors and the philosophical objectors? I know up in Vermont, for example, they've been trying to get rid of the philosophical objection to it, but the governor of the state himself said, you've got a right to object to it philosophically. You've got these inalienable rights, but they do tell you that you can't talk on the cell phone while you're in the car, and you have to wear a seatbelt because of the public health impact of this behavior. Talk to me about that.
Interesting enough is because most people abided by getting these vaccines over the years. It hasn't become an issue. So therefore, it's not really a public policy issue because there's not an outbreak or there's no negative ill globally or at least within the US, right? So it's not that bad. However, when do you say, wait a second, you need to get this versus not? I would say I truly believe, and my experience has been, that everyone should be vaccinated. The tricky part is, especially for religious and philosophical differences, I don't believe that they should, because it's kind of forcing them to get something done. But the reason why that's okay is because everyone else did. Does that make sense?
It makes total sense. And Patricia, I was
irony.
going to ask you
That's the irony.
That is the irony.
Yeah.
The public awareness campaigns, for example, you talked about shingles, and CVS, for example, advertises the need for adults over 50 to get the shingles vaccine all the time. They show the person with the debilitating illness, talking about the horrible repercussions of having the disease, who's vulnerable and who should get the shot. Is a similar campaign needed for measles?
I think so, and going back to what Tom was saying, we don't see the face of measles, mumps, rubella, or even polio as we used to when we were growing up, that our parents took seriously what could happen. That what we're doing now is the CDC actually has a program that says think measles. If a child comes in with conjunctivitis, or commonly known as pink eye, and runny nose and a dry cough, that starts to occur sometimes right at the time of outbreak of the rash, or it may not. And we're seeing a lot more of those campaigns. I'm the course coordinator for community nursing at Adelphi. So the 6 sections of that course, all the theory faculty give a 15-minute debriefing each week on the update. And then all of our 20 clinical instructors have the same information. So when they go out to the clinics, when they do health promotion and disease prevention, we're always bringing it to the forefront. And that's what a lot of other colleges and schools of nursing are doing as well.
Is there anything you can do once a patient has contracted measles other than ameliorate the symptoms?
That's pretty much it, is that you can give them comfort. High fever, we need to watch that. Because
are antivirals used?
Not really. If a pneumonia develops, which could actually occur, which is one of the more severe side effects, then it's usually a bacterial pneumonia treated with antibiotics. There are, unfortunately, some cases of deafness or hearing loss. And so you're monitoring those symptoms, but once the child gets measles, there's really not much except for maybe acetaminophen or Motrin to decrease the fever, sponge baths. I'm one of those people that had all 4 of those childhood diseases in the 2nd grade. My 2nd grade teacher never thought she was going to see me again. I remember how painful, believe it or not, measles was, because it also irritates the nerve endings. So you do have some children, unfortunately, very, very small amount, 0.02%, that would get a neurological disorder or encephalitis, inflammation of the brain nerves. But a lot of times it's a lot of aches and pains, similar to what you would have experienced with the flu. Very painful for a young child.
Dr. Ross, we have about 30 seconds. We talked a little bit about fear, and we talked about experience. I remember growing up with a mother who was born in 1919 of all times, knew all of these diseases, was scared to death to go to movie theaters during the summer because she'd be exposed to large crowds and maybe get polio. So that's what's missing right now. We've had it so good with vaccines working so well that we don't have the living examples in front of us of crippled children from polio necessarily, or people who have been scarred by measles.
Right, and I think the best way, real quick, to deal with fear is to deal with it directly and look at all of the aspects of your fear. And if you sort it out correctly and you look at common sense, you'll probably come up with the right decision.
All right, Doctor, thanks everybody on the panel for your thoughts and wisdom on this topic. It is an important one. And when we come back, America's top anchorman is toppled by his own words after this.